New research commissioned by the Ontario Lung Association shows that more than 2.4 million men, women, and children in Ontario have a serious lung disease, such as asthma, lung cancer, or COPD, which is chronic obstructive pulmonary disease. Tragically, the research also suggests that if we don't act now, almost 5 million people will be diagnosed with at least one of these diseases over the next 30 years. George Habib, President and CEO of the Ontario Lung Association, explains the urgent need in the province for an Ontario Lung Health Action Plan.
The fact is, millions of Ontarians are struggling to breathe. While much good work has been started, it simply isn't enough. The Ontario Lung Association is looking to the Government of Ontario to recognize lung disease as the healthcare priority it is. As partners and as members of the lung health community, we know what it takes to improve the situation. We just have to do it now and do it together.
The research was commissioned to help measure the extent and cost of lung disease here in Ontario, both now and up to 30 years in the future. The impact of lung disease, however, goes beyond facts and figures. Brenda Cunningham has COPD and lives every day struggling to breathe.
I have COPD, but I can still carry on. I can live a normal life. But I only put that on the outside. You don't see what's inside. And what's inside is the time that you spend alone and terrified that you're going to choke to death. Because every day with this disease is a struggle to breathe, to survive. Just to survive. It's very difficult with COPD.
The research also illustrates that if practical and effective actions are taken now, we can reduce suffering and deaths by improving lung health in Ontario and also save taxpayers hard-earned dollars. Dr. John Granton is encouraged by these results.
Well, the research undertaken by the OLA is very important because it really helps us understand the burden of these very significant lung illnesses, asthma, COPD, lung cancer, and tells us, well, how common is it? What is the impact upon patients, their families, as well as the economy? How big a deal is this? It also identifies areas that we can strategize and say, okay, where are we best able to invest? Where are the most likely areas of success? And economically, what makes the most sense to invest into?
To learn more about how you can support the call for an Ontario Lung Health Action Plan and to sign the petition, visit on.lung.ca. Sherry Dematarco reporting.